Hi friends, today we are going to study about avulsion. Let's get started. An avulsed tooth is the one that is completely dislodged from its socket. These are dental emergencies and require immediate treatment. The prognosis is very much dependent on the actions taken at the place of accident and promptly following the avulsion. In most situations, replantation is the treatment of choice. Now, if a tooth got avulsed, first of all make sure that it is a permanent tooth because primary teeth should never be replanted. Keep the patient calm, find the tooth and pick it up by the crown. Avoid touching the root. Attempt to place it back immediately into the jaw. If the tooth is dirty, rinse it gently in milk, saline, or in patient's saliva and replant it to its original position in the jaw. It is important to encourage the patient, guardian, teacher, or the other person to replant the tooth immediately at the emergency site. Once the tooth has been returned to its original position in the jaw, the patient should bite on gauze, a handkerchief, or a napkin to hold it in place. If replantation at the accident site is not possible or for any other reason it's not feasible, for example, the patient is unconscious, place the tooth as soon as possible in the storage or transport medium that is immediately available at the emergency site. This should be done quickly to avoid dehydration of the root surface, which starts to happen in a matter of few minutes. In descending order of preference, milk, Hank's-Spell and salt solution, saliva, or saline are suitable and convenient storage mediums. Although water is a very poor medium, but it is still better than leaving the tooth to air dry. The tooth can then be brought with the patient to the emergency clinic. Now, treatment choice depends upon two factors: root's maturity, that is whether the apex is open or closed, and the condition of the periodontal ligament cells. The condition of the pedial cells is dependent on the time out of the mouth and on the storage medium in which the avulsed tooth was kept. Minimizing the dry time is critical for survival of the pedial cells. After an extra-alveolar dry time of 30 minutes, most pedial cells are non-viable. Now, treatment guidelines for the avulsed tooth. Remove any debris from the surface of the avulsed tooth by slightly agitating it in the storage medium or in the stream of saline. Administer local anesthesia, preferably without the vasoconstrictor. Then irrigate the socket with sterile saline and check the socket for any fractures. If present, reposition the fractured segment in its original position. Then replant the tooth slowly with slight digital pressure. Stabilize the tooth for 2 weeks using a passive and flexible wire. In case of associated alveolar fractures, rigid splinting for 4 weeks is indicated. Suture any gingival lacerations. Now, if the apex is closed, initiate root canal treatment 2 weeks after the initial replantation. But if the apex is open, pulp revascularization is the main goal. The risk of external root resorption should be weighed against the chances of revascularization. If spontaneous revascularization does not occur, apexification or RCT should be initiated as soon as pulp necrosis and infection is identified. Then administer the systemic antibiotics, check the tetanus status, provide post-op instructions and follow-up. Now here are some situations when replantation is not indicated. For example, severe caries or periodontal disease, an uncooperative patient, severe cognitive impairment requiring sedation, severe medical conditions such as immunosuppression, severe cardiac conditions. That's all for today, guys. Thanks for watching. If you like the video, please like and share it and subscribe to the channel.